results of your microdermabrasion treatment don't live or die in the treatment room alone. When you build a 3-step protocol around your service, your results are dramatically improved and your clients see you as their skincare superhero. So what's the 3-step protocol? Well, it's fairly simple. Number 1 are the products that you apply before the machine even hits the skin. So number 2 are the products that you recommend for their home care, which in some cases may be the same products that you recommended for their pre-treatment. Number 3 is the education that you provide them about both the products and the treatment. So that's what separates a good outcome from a completely transformative one. Hi, my name's Terry Telford from the denéva Skincare Academy. Now our goal is to help you educate your clients using tools and educational resources that give them that aha moment and lock them into an understanding of why they need to follow the home care routine that you prescribe to them. And it means more loyal clients and ultimately more sales for you. Now, of course, we'd love it if you used and recommended the denéva skincare products, but these trainings and the resources are not product specific, so you can use and recommend any products that you wish. Now, having said that, in this training, I'm going to show you which denéva products are appropriate for which specific skin types, as well as what ingredients to look for in your particular protocols. Now, to open the conversation and make sure that we're both on the same page, I'm going to review some of the basics that I'm sure you're already familiar with, but it gives us a starting point that we'll build on in a couple of minutes. So microdermabrasion uses a controlled flow of crystals in a non-invasive procedure to gently abrade and exfoliate the surface of the skin. Now the treatment removes the outermost layer of the dead skin cells and resurfaces and exfoliates the skin and unclogs the pores. Now while it's doing that, it's simultaneously stimulating collagen production and reducing the appearance of large pores. So it removes oil, dirt, and bacteria from the surface, and it leaves the skin healthier and with a glowing, youthful appearance. Now, of course, from a clinical standpoint, this makes microdermabrasion one of the most versatile and accessible services on any treatment menu. And because it works on all skin types and all tones with literally no downtime, it's kind of been coined as the lunchtime facelift because the results are visible immediately. Now, for clients who are dealing with acne-scarred skin, or sun-damaged skin, or they're showing visible signs of aging, or even uneven texture, this treatment delivers meaningful improvements. Now, for optimal results around acne scars and discoloration, it's generally good practice to prescribe 5 to 8 treatments spaced about 7 to 10 days apart. Now, some of the contraindications or the factors that may limit or prevent starting a microdermabrasion. Number 1 is active acne. Number 2 is rosacea. 3 would be eczema. Number 4 would be a sunburn. Number 5 is deep scarring. And 6 is autoimmune disorders. Now in these cases, other than the deep scarring, it's best to wait until the symptoms are fully resolved before you start the process. So what's critical is what happens to the skin during the treatment at a physiological level, because the stratum corneum is mechanically disrupted, so the skin's barrier function is temporarily compromised, and the skin enters a heightened state of transepidermal water loss and sensitivity. So this is also the window of maximum product absorption, and that's exactly why the products that you apply immediately before and immediately after are so consequential. So your pre-treatment prep serves 2 clinical purposes. Number 1, it ensures the skin surface is clean and free of anything that could interfere with the abrasion process. And number 2, it brings the skin to an optimal baseline state so that it's hydrated enough to respond evenly to exfoliation, but not overloaded with actives that could cause a reaction. So 7 days prior to a treatment, you can advise your clients to discontinue any active exfoliating products, including AHAs, BHAs, and retinoids, because the compounding effect of chemical and mechanical exfoliation can lead to a significant overexfoliation that compromises the barrier integrity and heightens sensitivity during the treatment. You also want to ensure that your client is avoiding sun exposure and tanning beds the week before their treatment, because UV damaged or tanned skin is far more vulnerable to irritation during the abrasion process. So your in-clinic pre-treatment step should focus on a thorough but gentle cleanse that removes surface debris, removes excess sebum, and any residual product without stripping the skin's lipid layer. Because stripping the skin before adding a mechanical exfoliation is a protocol error that increases the risk of sensitivity and barrier disruption. So if you're using the denéva skincare products, the Equilibrium Facial Cleansing Lotion is a clinical grade emulsifying cleanser that's formulated to nurture while it cleanses. So it's an ideal pre-treatment product across a range of skin types, particularly for clients with dry, dehydrated, or sensitive skin. It has a pH of 6.5 to 7, so its neutral range supports a healthy skin function without disrupting the acid mantle ahead of the treatment. Because going into a microdermabrasion with an intact acid mantle reduces post-treatment reactivity and supports even more abrasion results. Now, from an ingredient standpoint, there's 4 main botanicals that make this cleanser perfect for your pre-treatment protocol. Number 1 is calendula extract, which promotes skin tautness and boosts hydration. It's a key defense against dehydration that can be amplified by mechanical exfoliation. It also supports collagen generation, which means it begins priming the skin for the same collagen stimulating process that microdermabrasion is designed to trigger. So applying it in the pre-treatment cleanse step creates a foundation that works with the treatment, not independently of it. Now the second ingredient is jojoba oil. Now this oil is chemically similar to the skin's own sebum, which gives it a unique ability to balance the surface sebum levels without occluding the pores or leaving a film that would interfere with the abrasion. So a well-balanced skin surface, neither stripped nor congested, responds more evenly and predictably to the crystal flow. So number 3 is sunflower oil. Now it delivers vitamin E and linoleic acid that provides antioxidant support and reinforces the skin's capacity to retain moisture. Now from a practitioner's standpoint, having a client's skin in a more hydrated state before you begin reduces the friction coefficient of the abrasion, and it can really help produce a more uniform result, particularly in clients with dry or flaky skin. And number 4 is apricot kernel oil. Now this is known for its softening, soothing, and healing properties. So beginning the service with a cleanser that actively conditions and calms the skin sets a more comfortable tone for the treatment, and it can reduce the appearance of post-treatment redness in the short window before the client leaves the clinic. Now the emulsifying lotion-based formula is also practical for professional use because it emulsifies on damp skin and wipes off cleanly with a warm towel. So there's no residue and there's no need for a secondary removal step before beginning the treatment. Now, after the treatment's been completed, you start the post-treatment protocol. So the 30 minutes immediately following a microdermabrasion treatment represents the single most impactful window for product penetration and the recovery support. Now, because the stratum corneum has been partially removed and the pores are clean and open, the skin is in a state of heightened absorption. So this is the moment where what you apply has a disproportionately large effect for better or for worse. So applying the wrong products, that's basically anything with an aggressive active or fragrances or occlusive mineral oils, can trigger significant irritation. So applying the right products accelerates recovery and amplifies the results. Now your post-treatment protocol should prioritize 3 clinical goals in sequence. Number 1 is calming and anti-inflammatory support. Number 2 is deep hydration and humectancy. And number 3 is barrier restoration. Now this is really the point where your client education about post-treatment home care is critical to maximizing the positive impact of the treatment. So you want to educate your clients to avoid 2 main issues that drastically reduce the effectiveness of your treatment. Number 1 is to avoid direct sun exposure and to use a broad spectrum SPF if they're going to go outdoors. Number 2 is to avoid all active treatments, retinoids, exfoliating acids, and vitamin C in ascorbic acid form for a minimum of 3 to 5 days. Now their home care in the days following their treatment should mirror your in-clinic post-care protocols. So they need to be gentle, hydrating, and barrier supportive. So if you're using and recommending the denéva skincare products, the Serenity Facial Serum is formulated specifically for sensitive and reactive skin, which is what your client is experiencing immediately after a microdermabrasion, regardless of their baseline skin type. So the Serenity Facial Serum is lightweight. It has a quick absorbing texture, which means it penetrates efficiently into the freshly exfoliated skin surface, and it delivers its active payload without requiring massage pressure that could further sensitize the skin. So here's the clinical rationale behind the 5 key ingredients as a post-treatment serum. Number 1 is aloe leaf extract, and this is a very well-established first response ingredient for post-procedural skin. It's a superior humectant that draws moisture into the skin, while its anti-inflammatory and cooling properties address the erythema and thermal sensation that the clients most commonly experience after the abrasion. Now, it also supports collagen synthesis, which directly extends and enhances the collagen-stimulating effect of the microdermabrasion itself. So applying it immediately post-treatment means your clinical stimulation and your topical support are working toward the same biological goal simultaneously. Number 2 is yeast extract, which is particularly relevant in a post-microdermabrasion context. Now, it actively stimulates cell regeneration and collagen production, which reinforces the treatment's primary mechanism of action rather than simply managing its side effects. Its anti-inflammatory compounds neutralize free radicals and calm irritation in the newly exposed skin layers, which are more susceptible to oxidative stress from environmental exposure. Number 3 is marine extracts, and they deliver a concentrated payload of minerals, vitamins, and amino acids that intensely hydrate and nourish the skin while reinforcing the moisture barrier. Now, after mechanical exfoliation, the skin's barrier is temporarily compromised and transepidermal water loss is elevated. So marine extract's ability to reinforce that barrier makes them highly clinically relevant. Now, their antioxidant properties also defend against environmental damage at a time when the skin's own defenses have been reduced. Number 4 is golden chamomile. Now, this little gem is a botanical extract with strong evidence for anti-redness and soothing activity. Now, in the first 24 to 48 hours post-treatment, it helps visibly reduce the inflammation response and calms reactivity, which is super important not just for client comfort, but for the clinical outcome, because prolonged post-treatment inflammation can slow healing and in some cases contribute to post-inflammatory hyperpigmentation, particularly in higher Fitzpatrick skin types. Number 5 is mushroom extract. Now, this contributes to superior water binding properties that sustain hydration in the freshly exfoliated skin and simultaneously support collagen production for firmness. So for building a results-driven protocol, the dual functionality of this ingredient is comfort and anti-aging support blended together. So apply the serum to the face and the neck directly after the treatment's complete and use gentle pressing motions rather than a massage. So this allows it to absorb fully before moving into the finishing moisturizer. Now, for the finishing moisturizer, barrier restoration becomes the priority. The Equilibrium Facial Moisturizer is the ideal finishing product for this stage of the protocol because it's formulated with rich lipids, plant-based hyaluronic acid, and multiple ceramide complexes, so it addresses the precise physiological needs of post-microdermabrasion skin at a structural level. So here's what we're looking at. 6 active ingredients that make this moisturizer incredibly effective. Number 1 is ceramides, NP, AP, and EOP. Now, this is the cornerstone of the product's clinical value in post-treatment context because ceramides are the primary lipid component of the stratum corneum and are directly responsible for maintaining barrier integrity. But the mechanical exfoliation disrupts the lipid matrix. So topically replenishing ceramides immediately after treatment accelerates barrier recovery, reduces sensitivity, and helps prevent the prolonged transepidermal water loss that can compromise results and client comfort over the following days. The inclusion of all three ceramide types reflects a comprehensive approach to barrier repair. Number 2 is hyaluronic acid in its plant-based form, and it functions as a powerful humectant that draws moisture to the skin surface and binds it there. So when you apply it to freshly exfoliated skin, its penetration is significantly enhanced, which means you're getting more functional hydration per application than you would to non-treated skin. So clients who tend toward dehydration or whose skin feels tight post-treatment, this ingredient is particularly impactful. Number 3 is jasmine butter. Now, jasmine butter delivers deep nourishment and soothing relief to compromised skin and simultaneously works to improve texture and reduce the visibility of fine lines and wrinkles. Now, this ingredient is clinically intelligent for a post-microdermabrasion product because it reinforces the aesthetic goals of the treatment or texture improvement and the anti-aging at the topical levels while the skin is healing. Number 4 is our macadamia emollient, which is rich in squalene, oleic acid, omega-6, linoleic acid, and in vitamin E. So now this ingredient supports cell regeneration and the reestablishment of the skin's natural protective barrier. So this means the moisturizer isn't simply sitting on top of the skin, it's actively contributing to the recovery of the barrier structure that the treatment has temporarily disrupted. The vitamin E component also adds antioxidant protection, supporting the skin against environmental oxidative stress during the vulnerable recovery window. Number 5 is avocado oil, and it has a very high content of vitamin A, D, E, and K. And it provides deep, non-greasy emollient support and produces collagen synthesis. Now again, the alignment between this topical collagen support and the treatment's intrinsic collagen stimulating mechanism is clinically meaningful. So you're reinforcing the primary benefit pathway of the service at the product level. So clients also appreciate that it absorbs without a heavy, greasy feeling, which matters when they're leaving the clinic and potentially heading back to work or to their daily activities. Number 6 is the Passiflora incarnata extract. Now this calms and soothes irritated skin while it's strengthening the barrier against moisture loss, and it improves an additional layer of anti-inflammatory and barrier support that complements the ceramide complex. And its antioxidant properties add further protection to the skin. So the moisture's pH is 5 to 5.5, which is clinically significant because it mirrors the skin's naturally slightly acidic environment and actively supports the restoration of the acid mantle that mechanical exfoliation disrupts. Now, this is an important detail that sets this product apart from generic finishing moisturizers. Now, while you're applying the moisturizer in a gentle upward pressing motion, it's also the ideal moment to educate the clients about their home care routine for the following days after the treatment. It's also the perfect place to be able to retail the cleanser, the serum, and the moisturizer for continued support at home. One of the most powerful things that you can do for your microdermabrasion clients and for your business is to close that gap between what happens in your treatment room and what happens at home. Because your clients who follow a proper home care protocol between sessions heal a lot faster, they experience less intertreatment sensitivity, and when they arrive at each appointment with skin that's in better condition, they can see more dramatic cumulative results, and they also become stronger advocates of your services. And from a product perspective, denéva's full product range provides a complete ecosystem that supports client skin between microdermabrasion sessions. Because these product collections never contain parabens, phthalates, mineral oils, sulfates, or any GMOs, they provide an environment that promotes truly healthy skin. And because they're cruelty-free, they're carbon neutral, and they're manufactured in Canada with sustainably sourced organic ingredients, they also represent a retail offering that you can stand behind ethically and professionally. So retailing the Equilibrium Facial Cleansing Lotion, the Serenity Facial Serum, and the Equilibrium Facial Moisturizer as a paired post-treatment home care kit gives your clients a seamless transition from your in-clinic protocol to their own home care routine with the same ingredients supporting their skin through the recovery and into the next session. And an additional tool that helps educate your clients and helps you seamlessly transition from treatment to product sales without feeling salesy is the Understanding the Science of Skin Health visual consultant that you can use to educate your client about how the skin works in terms that they can actually easily understand. Now, this tool gives you the advantage over your competition because an educated client is a loyal client. So go ahead and download your free Module 1 of Understanding the Science of Skin Health from denevaskincare.ca and start educating your clients and help increase your retail sales all at the same time. Now, thank you very much for your time, and we look forward to welcoming you to the denéva family.